Alrighty, welcome back. We are here to wrap up our muscle-less tutorial video and take a look at the muscles of the leg. So we're going to start on the posterior side with the gastrocnemius. That is your big calf muscle, this guy right here. So the gastrocnemius originates on the condyle of the femur and inserts on the calcaneal bone via your calcaneal tendon, which is the biggest tendon in your body, your Achilles tendon, if you've heard that word before. Its job is to plantar flex the foot, and it flexes the knee when the foot is dorsiflex. So remember, dorsiflex is your heel, your toes are up, and your heel is digging in, so that's dorsiflexion. So when your heel is dorsiflexed, or your foot is dorsiflexed, it helps to flex the leg at the knee, so it can help bend the knee, but it is your primary movement of plantar flexion. So pointing your toes. So contract your gastrocnemius and you will point your toes. The next muscle is the soleus, which sits just behind the gastrocnemius. So let me take this off here. So the soleus is this big flat muscle. You see a little bit of it here. So this is the big gastrocnemius. So this is the soleus. It originates on the proximal tibia and fibula. It also inserts via the calcaneal tendon to the calcaneus. And it is a plantar flexing foot. So the gastrocnemius and the soleus work together to plantar flex your foot. The gastrocnemius has a little bit more action because it crosses the knee joint. The popliteus, I should keep that off because I'm going to need to show you. The popliteus is this guy right here, number 28 on this particular model. So the popliteus originates on the lateral condyle of the femur. So here's our lateral portion of the leg over here, and it wraps around and inserts on the posterior surface of the tibial shaft, kind of on the proximal part. So here's our tibia, inserts here. Popliteus functions in the medial rotation of the tibia and a little bit of flexion of the knee, so helping to bend the knee because it crosses that joint. The next two are what we call fibularis, or sometimes they're seen as called peroneus. Get the gastrocnemius out of the way. So it's these two muscles here. We have the longus and the brevis. So the fibularis longus originates on the lateral condyle of the tibia. Oh, lost some of my words there. And also the fibula. And it inserts on the base of the first metatarsal and medial cuneiform. Now you might be thinking, okay, so here's these muscles on the lateral side of the foot, because that's the pinky side, that's your pinky toe. But it says it inserts on the base of the first metatarsal, which is going to be way over here. So what's the deal? Well, the deal is the tendon comes under the foot. I don't know if I can show that. And crosses and comes all the way over here. So this tendon goes under, and here's the base of the first metatarsal, kind of up under here. So that is your fibularis longus. The fibularis brevis also originates on the fibula and inserts on the base of the fifth metatarsal. So the brevis is a short little one that goes here. So the longus goes all the way up under the foot and attaches down here. The brevis just goes to the same side. Okay. Here we have what's called the tibialis anterior. It originates on the lateral condyle of the tibia, and it inserts on the base of the first metatarsal and the medial cuneiform, so kind of right in here. And this is your major plantar dorsiflex, and inverts the foot. So your tibialis anterior is your toe pointer, where your gastrocnemius was your dorsiflexor. So these are antagonistic of each other. Then we have the tibialis posterior, back here. We can just see a tiny little bit of it because it's really hooked to the very back of the tibia. So it originates on the tibia and the fibula, inserts on the tarsals and the metatarsals, kind of a generic insertion there. The tibialis posterior functions to adduct, invert, and plantar flexes the foot. Okay. Next, we have the flexor digitorum longus, which is this guy right here. So flexing the digits. So think about what's going to have to happen. That's curling your toes. So here this muscle has to come around the backside. It originates on the tibia. It inserts on the inferior surface of your phalanges. Excuse me. 2 through 5, so not your big toe, but 2 through 5. So it comes down here, tendon runs under, and it's going to flex your toes. Okay, so this is your flexor digitorum longus. And then we have on the front side, we got to straighten your toes. So this is your extensor digitorum longus. Starts on the lateral condyle of the tibia and the fibula, and then it connects to the superior surfaces of your phalanges 2 through 5 and extends your toes. So again, those are antagonistic. We have one that's going to curl your toes. That's a flexor digitorum longus, and then our extensor digitorum longus straightens your toes, flexing, straightening. Just like we had our flexors and extenders of our forearm, we have our flexors and extenders of our lower leg. Okay, we went through the muscle list. Good luck, and I wish you all the best. Bye.